Hi everybody, welcome back to Clinical Update. This is week 2. I hope you enjoyed week 1 and I hope it clarified some questions. I think providing the rationale is really a good thing so that we kind of know why we're doing things. We should always ask why. So I'm going to talk about, this one's going to be a little shorter. I'm going to talk about a couple things that were on the board that we have not addressed yet. So the first one is, how do you use a Dandel roll? So I've got my little table and my little baby. Okay, so we would obviously hands midline towards the face for calming. We'll do that. So I have my Dandel roll right here. So the way you put it, I always look at it as it's going to look like the baby's sitting on a swing. So what you do is you want to bring the hips in forward flexion, and it's actually the hips in a posterior tilt. And then you put your Dandel roll right here, and you secure it here, and so you secure it here. So it's like they're sitting on a swing. And what that does is that prevents the hips from externally rotating, because you don't want this to happen, okay? So you want to keep them flexed, and then what you do is you secure it like this, okay? So that's how you use the Dandel roll. Next question. Do we need an order for CPAP, going to a CPAP mask? No, you do not. But the thing that we want to remember when we switch from CPAP mask to CPAP prongs, the literature does show that both are effective. However, when alternating either every 6 hours or every 12 hours, the research shows that babies have stayed on the vent on CPAP for many more days, up to a week longer, because what happens is at any time you remove the prongs or remove any of it, they're going to be losing recruitment, and it takes minutes, hours to re-recruit. So, and when we do go to a mask, we are going there because we are noticing some skin breakdown. So you do not need an order. However, the physician needs to know that you are converting to a mask, because they need to know that there's skin breakdown, and then they can help make the decision. The decision has to be a team effort. The physician, the bedside nurse, charge nurse would be informed, and especially, obviously, the respiratory therapist. So I hope that's clear. Again, we want to avoid the constant rotation of every 6 hours and every 12 hours. And again, some centers do that in a standard manner, but research does show that babies will come off of CPAP many more days later than if you just use prongs. So hopefully that answers you. The next one is use of humidity. Actually, we are redoing the policy right now, and our practice is going to change pretty drastically. We're going to break it down from 23 to 26 weeks. We're going to start in 80% humidity from 26 to 30 weeks. 30 weeks, I think that's something like that. We're going to start at 70%, and after the first week, we're going to go to 50% until 30 weeks, no longer 32 weeks. What the literature is showing is that too much humidity, go figure, actually delays maturing of the skin. So more to come on that. So no changes right now, but policy is going this week to Clinical Practice Council, and when it does get all approved, we will have a little bit more education on that. But great question. And actually, it is a little different in the Draeger, and there was a question on the board and it wasn't quite clear, so whoever asked it, if you can be a little bit more clear on what you're asking, that will be helpful to me. And then finally, when do we stop using donor breast milk? So currently our practice is stopping donor breast milk at 34 weeks, and then weaning to NeoSure after that over a couple of days. We don't want to go drastic. We'll go 50-50 for a day or two, and then to the NeoSure. The one thing that we may come off donor milk sooner is if a baby's having some issues with growth. So sometimes it will be on an individual basis, but currently our overall practice is going to be 34 weeks. So hopefully this helped. Stay tuned for more of this every week. Keep those questions coming. There might be some weeks that we kind of pass on some clinical updates that are coming down the pike, but for the first month or so, let's just clarify some things that are going on that might be confusing, and we'll help answer them. Okay, have a great weekend. Bye.